Hi, my name is Dr. Sanaz Khorrami. I'm an internist based out of Newport Beach, California.
Hi, my name is Dr. Nikravan. I'm an endocrinologist and also an internist practicing out of Newport Beach, Southern California. Today is April 24th, 2020, and this is a COVID-19 update.
What we would like to discuss with you today is facts about COVID. We would like to go over some statistics, how to interpret these statistics, what these statistics mean for you, and also we'll discuss briefly about testing, the updates on testing, and how we're going to be able to get back into normal life at this point. So let's start with statistics in the US. Can you tell us a little bit about the COVID statistics in the US currently?
So the statistics are basically in all the information that are gathered to be presented, and unfortunately statistics can be flawed substantially if you don't have all the data. Based on everything we've seen so far, we have about 52,000 deaths in the United States, and that's out of 925,000 people who were tested as of April 24th. That's about a 5% mortality.
Correct. And then just to tease that out a little bit, let's look at two of the states that have been hit the hardest. First, New York, they've had about 22,000 deaths, and they've had 277,000 people who tested positive. So their mortality is 7%, whereas California has had 1,600 deaths out of 40,000 people who are positive. So they're at 4%. So a big difference even within mortality within the states.
If you look at the world data indicates there's about 200,000 people who've died of COVID, and that's if it's accurate, because there's a lot of reports are not presenting themselves. Out of 2.8 million people who have been infected, tested positive for COVID, that's about 7% mortality for the world globally.
And even in the world, there's a big variation, whereas Germany has about a 3% mortality, whereas Italy had about 13% mortality. So looking at these, we can say the average mortality of what we're seeing is somewhere around 5%. And that's pretty scary. That's a high mortality. But is this accurate?
I don't think that's accurate. And the reason it's not accurate because all your asymptomatic mild cases are not being tested. Those patients who want to be tested can't get tested. And many people who've had the disease, even somewhere back in December or January, had no idea what they had and they never got tested. So therefore, if the denominator is very, very low, you're going to get a high percentages. If people can readily test.
Yes, and I can attest to this as a physician in the community myself. Even though we've been exceptionally proactive in our practice to try and test people, every single day we run into a hurdle. When we try to get the nasal swab for patients, the community tells us that if they're not over 65, if they don't have comorbidities, they deny us the test. So a lot of patients, we're just treating them presumed COVID, but we never actually have a positive test, and it's never documented. The other thing is, what's happening essentially is these tested numbers that you're seeing are the sickest of the sick that are presenting to the hospital, and that's what they're counting as the positives. And then of those, they're looking at what percentage is dying. So they're not looking at the whole population that's actually been infected. They're not looking at asymptomatics. If those were actually factored in, the number would probably be about 2 to 3 times higher, and our mortality would be somewhere close to 1% or lower.
Correct, because the people being tested who go into the denominator, and the bigger the denominator, the smaller the percentages. And that's why it's important to understand statistics, and these statistics are actually flawed because the data is actually flawed.
So the good news about this is that this disease is not as deadly as we thought. It's deadlier than the flu, it seems, but it's not as deadly as we thought.
When you compare this to the flu, approximately about 61,000 to 80,000 people died of the flu last year from 2017 to 2018, and that's out of 45 million people infected. When you do the math, that's about 0.1% death rate from the flu. Although this COVID-19 is a worse disease than the flu, but the statistics, when you put the numbers together, it's about 1%.
So when you're comparing it to the 2017 statistic, I thought this was actually very interesting. So they had about somewhere between 60 to 80,000 deaths that year. Schools didn't close.
Yes.
The economy didn't shut down. People went about their lives as normal. And we had about 80,000 deaths between 2017 to 2018. Right now we're at 52,000 deaths. The only huge difference right here that we are looking at in terms of numbers is that they tested 45 million people because tests were readily available.
Exactly. The rapid flu test is something you get in the office. It's very quick. It's readily available. It's available everywhere. you get the results in probably under 5 to 10 minutes, and the results are, really easy to interpret. And people who have the flu actually are very sick. They're not asymptomatic carriers, unlike COVID, which changes the disease profile, actually.
So again, we're not saying that this is the flu, but we're saying is that because we're not testing enough people, because there's asymptomatic carriers, the numbers and the mortality looks much worse. And while it's still a very serious disease, it is not as deadly as we had thought.
If you look at the CDC projection, they project about 100,000 to 240,000. Let's say if we did no hand washing, no strict isolation, no distance isolation whatsoever, at worst case scenario, 500,000, 250,000 people would die from the COVID. And in between 100 to 240,000 people would die. But that's just a projection. And unfortunately, the media has run with this projection, has made a really big news out of it too, unfortunately, for whatever reason they are deemed necessary.
I mean, it makes sense to do the social isolation we've been doing and the medication things such as, washing our hands, keeping some distance, because hopefully we're a lot closer to 100,000 that's projected rather than the 250,000.
Correct.
And maybe even lower. But it is important to keep in mind that such a thing as the flu in 2017 did lose about close to 80,000 people, and it did not get this much media coverage. So now, okay, that being said, testing, let's talk a little bit about testing. What we're hoping is that by getting more testing, we'll get better numbers, more accurate numbers, and we'll really have an idea of how deadly this disease is.
Yes, exactly. Testing is not readily available. Don't let anyone tell you anything different. The testing is being done on selected patients if they have high enough risk, if they have the comorbid conditions, if they're more than 65 years of age, if they present with numerous symptoms that checks the box specifically, and then they will be tested, which is absolutely ridiculous.
And I think we're one of the states that actually has been actively testing the most. So in other states, I mean, really, it's not even available to a lot of physicians that I hear from to get tested.
So testing, we have the nasopharyngeal swab, which we talked about in our prior video. Sensitivity is about 63-65% if you're acutely ill with symptoms.
Right. So if you're ill and you're having cough, fever, that's the best test to get, because that test is going to check for the virus RNA. And when you're ill, that's when your RNA load will be the highest. So that is the correct test to get. But how about the serum?
We get a lot of questions,
test.
and we promised our patients to post this video, and a lot of questions that I think both of us are getting is about the serum immunoglobulin testing, IgM, IgG here. A lot of labs went into this to get the information. Unfortunately, FDA did not approve them for the right reasons, because they have not been validated. It's very, very important we get the right labs to give us the right answer. Currently, Abbott Laboratory has worked with Quest Diagnostic, and they released an IgG, which is an immunity. That means you've been exposed before. And the sensitivity is very impressive, very, very impressive.
Exactly. This was released actually just on the 21st, so we have not had access to this up until now. But the sensitivity is 100%. That means if it's there, the antibody will pick it up. The specificity is 99.5%. So there's still a small chance that it may not be specific to this COVID-19, but that's a very smart percentage. So this is as accurate of a test as we have out there.
And this is a test that means if you were exposed to the COVID virus last month, 2 months ago, or 4 or 5 weeks ago, your body's built immunity, and your body's checking for this thing called serum immunoglobulin, IgG. You're looking for that. And it usually takes several weeks to develop this if you have a strong immune system. That's if you develop the antibody. That means you have now been exposed. Does it mean you're immune to the disease or not?
We think so, but we don't know for how long, or can you still get a mild form of the disease, but we do think that it does give you some immunity.
Correct.
What do you think in terms of the finger prick test that's been talked about?
There are two companies. One is called Celix and Biomedics, and these companies are actually finger tests, which is IgM and IgG. But unfortunately, they've not been FDA approved or cleared to give the go-ahead signal. And they're about somewhere in the high 80% sensitivity and specificity.
At best, maybe 90%.
9%, which that means a good 15 to 20% of patients can get missed, unfortunately. So we are not recommending those tests yet unless they get better sensitivity specificity. And that's very, very important, because you want to tell the patient yes or no. That's the answer you're looking for.
Yes. So as of April 24th, Our recommendation is not to do the finger prick test for the time being, and to do the serum blood draw test that will tell you IgG is positive or not, and it will tell you if you've had the infection in the past. That is probably not the best test. I mean, it is not the best test to get if you're acutely ill, because it does not pick up on acute illness. It just will tell you if you've been exposed to it in the past.
So in conclusion, what we like to say is that based on the statistics that we presented to you, we interpreted the data as actually false. It is not accurate because they are actually magnifying the data, number one. The most important thing is that the data is not as bad as we thought comparison to Italy's data.
Yes.
And for whatever reason, elderly, smoking, alcohol, elder population, closer proximity, we don't really know this stuff because we're learning as we're going on with this here. That's one big thing. And the other thing is that I kind of want Dr. Khorrami to talk about this social isolation and the flu comparison. Where do you go with this?
So now, now that we have this testing that's become available, the one I was just mentioning, if you test positive for the IgG, that gives you some level of safety of knowing, okay, if I go out there, I'm not going to be getting the disease, or hopefully not as severely, and I won't expose other people. So it'll be very important as this test that gets incorporated into the population and more people test, it'll be easier for people to go out there. But so there's two ways really that we can move forward from this. One is going to be if we get a vaccine, and one is herd immunity.
Before we get to the herd immunity, I just want to give the audience that 85% of people who get COVID will be mild to moderate. They will most likely recover at home with the supervision of their physician.
Yes.
Very, very important. Keep a close contact with your physician. About 85% of people, 15 to 20% of patients will require acute care, hospitalization, dehydration, IV fluids, oxygen, or maybe even get in the ICU for possible ventilation. So a very small subset of patients really require acute care.
But even out of that 15% that may need medical care, it's really, most likely that less than 1% would die.
So if the testing was adequate, just like the flu, we feel certain that the death rate would not be 4, 5, 7%. It would be at best 1%. And therefore, that's a lot less than what has been publicized. So take a deep sigh of relief.
Okay. So now we're talking about how to get back into society. So vaccine would be one modality. If there's a vaccine, we could all get it. We could all go back. But the reality is, what the projections we're seeing is that the vaccine will probably be available to the mass public sometime by spring of 2021. So the other thing that could help is herd immunity. So can you tell us a little bit about herd immunity and what that means?
Well, herd immunity means enough people or population getting subjected to the virus. So it needs at least about 60 to 70% of the population to get infected with this virus so they can build antibodies, so they don't keep passing this virus to other people. So that it's kind of a long shot. That means a lot of people have to go out there and get infected to build up the antibodies so they don't infect others. It's a great theory. The question is, it may take a long time.
It'll take a long time, but the idea is as more people go out there and get infected and build the antibodies, you'll be less and less at risk over time. Okay, but again, between both vaccine and herd immunity, this is going to take a long time. So how do we, go back to regular? Are we going to self-isolate for the next 12 months? Are we going to just shelter in place?
Tough one. But I kind of want to go back to the vaccine for 1 second. You put a good point towards it too. I think if we skip the animal studies and the animal control studies, we may get lucky to have the vaccine sometime end of this year, December. But that's not the standard protocol for vaccine. Dr. Khorrami is right. Usually it takes a long time to get the vaccine, but there's a lot of human subjects who actually did the vaccination trials, right. And that is basically bypassing animal studies. So therefore, we may get the vaccine 4 to 5 months sooner than projected. So if we're lucky, maybe December of 2020 at best, if we're lucky. But that's just guessing.
So if we don't get the vaccine, for the time being that we don't have the vaccine and the herd immunity hasn't built yet, how do we go about our regular lives? I mean, for most people, the idea of sheltering in place for the next, 6 to 9 to 12 months just seems unbearable.
Yeah, that could lead to chaos, depression, anxiety, and all other kind of problems.
And economically, I think it'll be extremely detrimental for us.
Word of caution is the people that need to take the most amount of caution are people who are on immune suppressants. If you're an organ transplant recipient, if you have a transplant heart, kidney, lung, liver, if you have any organs that are transplanted, if you're on immune suppressive therapy, you have to take extra precautions because that means you're a high risk. If you are a heart disease patients. Often I get this question is like, Dr. Nikravan, I have diabetes, am I at more risk? The answer to the question is, if you're a poorly controlled diabetic who doesn't really care for their diabetes, who lives a poor lifestyle here, yes, you're at a higher risk. But if you're well controlled, well managed, with great values, good lifestyle, and you're doing the best you can, your risk of developing a complication to COVID is really not that different, as long as you follow the recommendations by your physicians.
So now, obviously, we all have to follow the rules that our county, our state puts forward. But as time goes on, those rules will change, and more businesses will open, and so on. So I'm going to go over just a couple of the common things our patients have been asking us. First thing is, physical and mental health is closely related to exercise. So I keep getting asked, what kind of exercise can I do? Can I go to the golf course? Can I go to the local pool? Can I go hiking, biking? What do you think of that?
I think as long as the exercise is outdoors, it's very safe. Just put on a mask, keep a social distance of at least 6 feet, and just go out for your hike. And with a strict hand washing before and after, and you should be safe. I mean, you really can't isolate your life and put your life on hold.
If you're going to go play golf, if you're not sharing, things to eat, and you're using your own clubs, and afterwards you're making sure you're washing your hands and you're keeping that distance from someone, being out in the open air, I think does a lot of good for people. And if you don't fall into that group, which is very high risk, then there is some benefit. I mean, obviously there's going to be some risk to all of these behaviors.
Correct.
But you have to look at the risk-benefit ratio, and if the benefit is higher than the risk, if it helps your mental status and your physical being,
your sanity,
then it makes sense.
Absolutely. One thing else is that very important, that social gathering, we as humans thrive on social gathering and interaction, friends and family, and just going places, and just people isolation at home has driven actually a lot of patients just mad, and actually it's very difficult. So what would you recommend, Dr. Khorrami, if how would you come up with a formula that at least is, in your opinion, a way to deal with this social isolation? Can you give us some ideas?
So I think, it will be important to continue isolation to some degree, but at least once, several times a day, I get asked about, can I go see my grandkids? Can I have a friend? I think the best way to address that issue is that as time goes on, if you can have a group, a closed group is what I call it, and that closed group is either a friend or a family that you guys are close with, or people within your own family, grandkids, and you guys all see each other, but you're not seeing other people. So you're exposed to each other, but you're not bringing other people from the outside into that group, then I think that's okay.
Sounds like a fraternity to me.
Yeah, I mean, I think that's probably as close as you can get. And of course, there's still, some risk, but I think that's okay to do, because you're not bringing a lot of other sources of people that could introduce an infection.
Yeah, make sure you don't have a weak link in that social gathering that kind of goes off and wanders off and comes back, because that's going to be the person who's going to break the link. And so a closed network of people who are entrusted to obey those rules are a great way you guys can go on.
Now, within that group, though, people do go out to the grocery store. That's a normal thing. You need to go get food. People will go out to the pharmacy. And I think those are accepted outings. And the risk is something that's accepted because everybody has to do that. And as long as they do it in a safe manner with, keeping distance from other people, washing hands when they get home, I think that's fine. So I read about a very interesting study. This is a New England Journal of Medicine. If you want to look at this is a study that was done in Iceland. Mm-hmm. They started targeting 2 people. One was just the population at large. They invited like 10,000 people to get tested for COVID. And then they invited several other thousand of targeted people who were at a high risk for infection. And among these groups, one of the most interesting things they found is that their infection was much less in women. That's something, I guess, a good thing that we have. But it was extremely low in kids, especially kids 0 to 10 years of age. And so one of the things that people keep asking me, can I see my grandkids? When will my kids go back to school? It appeared that actually in the population at large where they tested, the percentage of kids that were infected was 0 from the age less than 10. So it seems that even though we've been so worried about kids being carriers of this, there's more and more evidence coming that even though it's possible, it's just much less likely for kids to transmit the infection.
And I think that's because the kids have a less receptor of ACE receptor representation within the respiratory tract system, which the virus needs to attach itself to come into the system too. But again, this is our opinion regarding what we are recommending for our patients. You must consult your doctor, and each case should be individualized, which is very, very important. No key fits every lock.
And again, like I was saying, that, with every time you expose yourself, whether it's a child or an adult, there is going to be some inherent risk. But we're looking at what is the less risky versus the most risky behavior. So I think as time goes on and restrictions are lifted in different areas, you can engage in more physical activity, outdoors activity, and perhaps some socialization with a very small group of people that are only socializing with you.
Correct. Make sure you obey the strict hand washing and the social isolation distancing, especially when you go back. And the reason for that is if you let your guard down, we expect and anticipate to be a really big second rise of this COVID effect. Because if we lift our guard down, go back to the way our lives were before, we're going to get into trouble. So therefore, follow the guidelines, use common sense about hand washing, and do the things that we talked about before so you can lessen the risk until you buy yourself time until the vaccine comes out. And once the vaccine comes out, hopefully we can kind of relax a little bit until we find out what the next vaccine is and the next gift we get from elsewhere.
So thank you for joining us. We hope this is helpful to you. We hope that this maybe puts some of your fears to rest a little bit at least, because I think everything we're learning is positive. There is new tests that are out now that are available to a larger percentage of the population. The statistics are looking better. The disease is not as deadly as we thought. And hopefully in the next few weeks, more and more restrictions will be lifted so we can resume a little bit more normal level of interaction.
Great. So guys, I hope you guys enjoyed the video. Please, if you have not subscribed to the channel, subscribe to the channel, turn your bell notification on when we come up with more content, new updates, so we can bring the information to you conveniently. We wish you all the best, and God bless you.
Thank you.